Okay, hi everyone. So for those of you who don't know me, my name is Yosha Singh. I'm a third-year medical student at UT Austin Del Med. Some of y'all are medical students, some of y'all are undergrad in the health and society major. And so if you could please use the QR code to sign in and offer your email. I can give you follow-up through that email. We also have a mailing list through the Students for a National Health Program interest group. We also have snacks here for those who are in person who want to go eat. But yes, this is the third lecture in our installment series, Health Insurance and Organizing. This lecture is called COVID-19, What Happened, What Didn't. And I want to give a shout out to all the people who are named up there. All of these people had something to do with this lecture today. And so it was a team effort for sure. This is another reminder to please sign in. And this is a reminder to please take out your phones right now and use the QR code to at least have the feedback form on your phone. There's 6 questions total technically, but it's really only 3. And it's very helpful for future series to inform what y'all liked, what y'all didn't like. But yeah, so this is a 5-part series. Some of y'all were able to attend the first lecture called Intro to Health Insurance and Organizing, where we learned about like the basic health system structure in the United States, how by default we are uninsured in the United States unless you are represented by, for the most part, private health insurance companies, or Medicare if you're over 65, or Medicaid, with a difference per state. Our second lecture was entitled Privatized Healthcare and Organized Capital. We learned a little bit about Medigap, ACO REACH, Medicare Advantage, and basically how privatizing health insurance has affected both physician practice and also patient care. There are YouTube links available, so let me know if you need them. But otherwise, you can go ahead and start with COVID-19, what happened, what didn't. These are technically the learning objectives for today, and on the feedback form that hopefully you have because you used the QR code, you can see them, but overarchingly, what you can expect from today's lecture are these kind of 3 main goals. So we're going to identify how structural determinants, racism, capitalism, and racial capitalism mediated COVID outcomes in the United States. We're going to differentiate neoliberal reforms from transformational reforms, and we're going to describe U.S. labor organizing in the wake of COVID. We also have 2 superstar MS1s who are going to be reporting on the labor organizing, and so you can expect that at the end of the lecture. Uh-oh, it's going backwards. Okay, so to start, out of the 6.9 million deaths that have happened in the past 3 years, the United States has led in absolute death cases overarchingly. We have killed 1.117 million people. We represent 4.25% of the entire world's population, and we represent 16.2% of all deaths in COVID worldwide. The only next leading country is Brazil at 700,000 roughly, so not even in the millions, which is just to say that we are well in advance of the second leading country. After that, we have India. I don't know about y'all, I'm Indian, and I remember hearing a lot of stories back home of like, oh my gosh, so many deaths happening, so many sicknesses happening, and that is so real, and that is so true, and we are 2 times the rate of that death in the United States. And so here you see a graph on the side. These are the top 12 countries that have the highest level of deaths from COVID. And the United States is right here representing a majority of that pie. It's not just COVID deaths specifically that have happened post-COVID-19. So on the left, we have a Commonwealth Fund graph kind of describing how because of the shock to the health system, people with chronic heart disease or conditions like heart disease and diabetes were not able to seek out care, have experienced more morbidity and mortality as a function of how COVID, like I said, shocked our health system. The other thing to notice is that our death rates in comparison to Western Europe, we'll go into the structural determinants of health and the rest of these slides, but it's also key to remember that we have a higher incidence of diabetes and heart disease compared to Western Europe. So again, our population is a little bit, even if by age we have similar, like people who are above 65, people who are above 40 in terms of proportions, we have more chronic disease burden. Also on the right here, we have our state of Texas, which is scored 48 out of 51 in terms of a health system. And if we're only going to compare it to its region, we are 3 out of 4. So we are really not killing it, y'all. COVID-19 outcomes, we rank 44th. And in terms of access and affordability to care, remembering that Texas is a state that did not choose to expand Medicaid, we have some of the least accessible insurance in our state compared to the rest of the United States. I also want to highlight that it's not just what we consider like physiologic disease that was impacted post-COVID, but also drug overdose deaths have, just really skyrocketed post-2020. In Texas, the level of deaths that we can attribute to an overdose over the past, I want to say year, if not year and a half, has risen 399%. And so that's just to kind of keep in context, what is the health burden that we're dealing with when we think about a post-COVID, and not post-COVID because we're in the middle of it, so in a COVID world. Now, I remember early in the pandemic when many people were in their homes, we were all on Twitter and online, all these things. And some of the commentary early on included the idea that, COVID is the big equalizer. COVID is making it so that we all have to stay in our homes. We're all in it together. Celebrities are singing, I can show you the world, or whatever they sang, and that combined thing to show, we're all in this together. But many years after the fact, it is incredibly evidence-based to say that that is not true. So on the left, we see an Economic Policy Institute study. Black workers face 2 of the most lethal pre-existing conditions for the coronavirus, so racism and economic inequality. One thing that I want to make sure and point out here is that it is not Blackness that mediates the outcome of worse health outcomes. It is not race itself. It is racism. It is the way that the historical extraction of wealth from a sect of people has now been couched in different social determinants of health that has mediated these outcomes. So that's a really important, I think, distinguishing mark to make, is that it is not race, it is racism. And so, as you can see here, Black Americans made up 12.5% of the US population in 2020 and accounted for 22.4% of COVID deaths. So again, United States, #1 killer in terms of COVID, and those effects are not equal. On the right, we have US billionaires got 62% richer during the pandemic. They are now up to 1.8 trillion. And this is also a little dated. This is 2021, so this has only gotten worse. And then here I've just included a Journal of Preventative Medicine report that talks about how countries with severe and persistent income inequality, it was their recommendation, should develop national strategies to address the challenge to be better prepared for future pandemics, because countries that had more unequal income distribution faced worse COVID deaths. So what does that mean? Why is it income inequality is the reason why there could be more spread of death? Well, we have to remember that one of the things that is interesting about infectious disease, as opposed to, or not opposed to, but even more so than chronic disease, is the idea that infectious disease is basic sciences plus social determinants of health. It is those 2 things that kind of propagate the disease forward. And so, infectious disease, coronavirus, does not adhere to random boundaries. The state of Texas, because it's not going to not enter the state of Texas. We are in a global pandemic. And so the idea of how our entire society is structured, the exposure risk that the bottom 50% of the population faces, ultimately mediates how that virus is able to continue to spread. So if we don't bring it down to 0, if we don't go out of our way to ensure that people are safe and healthy, then this pandemic, then the virus continues to propagate, continues to mutate, and continues to infect people. So, racial capitalism, what does that mean? So this term was originally coined by Cedric Robinson. And I'm going to like a dummy version of what does capitalism mean? It is an economic system in which private actors own and control the property, means of production, and means of means of production for goods and services for a profit motive. So what does that mean? It means the company owns the factory. It means the company owns the hospital. It means the CEO of Ascension Seton owns the hospital. The residents don't. The doctors don't. The physicians, like, they are not the people who own it. This is in contrast to socialism, an economic system in which workers or the government own the means of production. One misnomer or kind of misclassification that I often see is the idea of, oh, it is only a centrally owned system, and that doesn't have to be true. So, for example, socialism, the socializing of our economic system, can be decentralized. So there can be direct worker-owned companies, or it can be centralized through state ownership. But just to kind of keep some terms in our minds. So racial capitalism is the idea of ensuring that the lowest wage workers, the people that you are trying to extract the most profit from, try and, because of a profit motive, try and take out as much profit as you can as possible from any means, are racialized. So as you can see here, this is the same Economic Policy Institute report. Black workers were and are more likely than other workers to be in frontline jobs. Black workers are less likely to get paid sick leave. Some other facts. Let's see, unemployment rates are higher among the Black population. Black women face the largest losses in employment post-COVID. Black families were more likely to live in areas experiencing outbreaks as well as air pollution, which also mediated COPD, asthma rates, and then subsequent interactions with COVID. And Black essential workers were also more likely to be uninsured than white essential workers. So this is just to say that there's a racialized and also economicized mediation for how COVID affected the United States population. So what are some examples of racial capitalizing driving workplace transmission of COVID? So these are just two examples. This is a paper written by one of our own, Dr. Snehal Patel, and a few other authors, entitled Racial Capitalism Within Public Health, How Occupational Settings Drive COVID-19 Disparities. And so I'm going to have two basically case examples. There are plenty that we can go over. One is construction workers. So in Austin, Texas, there are around 50,000 workers. Around 50% are undocumented, and then more than half get below poverty wages. Originally, the federal government had basically said that construction workers were non-essential. So it was not a requirement for them to go out and do construction work. However, our guy, Greg Abbott, created a statewide order to ensure that construction workers were actually labeled as essential workers. So during the COVID pandemic, when we were all locked in, when people who, I'm so sorry, these are my friends, worked at Deloitte and Accenture and these random companies working from inside our homes saying, oh my gosh, we're so sad because we're socially isolated. And I hear you, we were all sad. In fact, drug overdose deaths, like I've talked about, have only increased and skyrocketed. The reality is that that suffering is also juxtaposed against the suffering of having to show up to a job that is not actually essential, that risks your life. So Latinx workers were sick and dying from COVID-19 much higher than workers in any other industry. The majority of cluster cases in Austin were linked to construction work sites. Surveillance testing found that the rate of positive tests was around 3.5 times higher in the construction worker community compared to the general population. Now, let's contrast that with medical doctors. Medical doctors are arguably in the highest exposure setting. They are around COVID-19 patients. But retroactive studies and many studies at the time also have found that infection rates for medical doctors are similar to the public despite high levels of exposure. How could that be? Some of the things that explain this are the idea that when medical doctors or when people from a certain tax brackets, people from a certain income or job are better able to negotiate for PPE, they're better able to make demands from their employers, whereas in the case example of construction workers in Austin, an undocumented low-wage worker by themselves doesn't have necessarily the power or the authority to demand PPE, to demand the things that keep people safe. And so this is just an exemplification of how outcomes were driven by the exploitation of labor. This is not necessarily about multi-generational households, inadequate personal hygiene, or poor health literacy. While those social determinants are things that can drive outcomes, it's important to consider how structural determinants trickle into social determinants, which then trickle into health outcomes. And so this is just kind of the similar thing of what separates the US from other OECD countries performing better on COVID outcomes. Nearly half of our population is uninsured or underinsured, which means that your insurance plan isn't adequate for your health needs. We have limited and inequitable paid sick leave, universal child care, other social service benefits. And what is profoundly sad is the idea that 2/3 of US adults say that their potential out-of-pocket costs are what would drive them away from getting either COVID tested or like go seek medical care. And again, what separates marginalized workers with greater COVID risk from the general public? This includes employment in frontline work, less access to paid sick leave and health insurance, familial cash reserves, which as we know are inequitably distributed, living in areas with high population density, number of earners in a household, and so on. Now, interestingly, insurance coverage, although we are already very poor in that, did not get worse. And how could that be? That doesn't make any sense, right? Millions of Americans lost health insurance in the pandemic-driven recession. This is a headline from like beginning 2020, like in April 20 or August 2020. There are three main things that explain the stability, the quote-unquote stability that we saw in insurance coverage. First of all, the people who lost their jobs were less likely to have health insurance anyways, which is just to say the doubly compounding effect of how COVID-19 marginalized and further marginalized communities who are already experiencing health inequities in the first place. The other idea is that the Families First Coronavirus Response Act, long story short, basically had this way of telling states, you don't need to reevaluate the people who are on Medicaid to stay on Medicaid. They're like, just keep them on Medicaid. And that ends today with the end of the public health emergency title for COVID-19. As of literally today, March 31st, nearly 1 in 10 Texans is susceptible to losing their health insurance. So like in this room alone, that's at least what, 2 of you? Like at least 2 of you. And then like bring that to the state level. Now, I told you earlier that one of our learning objectives today is going to be the idea of neoliberal reforms versus transformational reforms. So what is neoliberalism? Now, that is a term that has been kind of like, how do I say this? The definition now is a little broad because there's a historical element to it. There's a way that we use it in common everyday language now. But kind of very succinctly, what I would tell you is that neoliberalism is a post-World War II term to rejuvenate the idea of classical liberalism or free market enterprise, like laissez-faire types of markets that had kind of seen a downturn. So it was like the upping of that kind of economic model. Per Friedrich Hayek, who is a very important in terms of like this sect of thought, economic thought, has quoted, the competition of neoliberalism would establish an elite structure of successful individuals that would assume power in society, with these elites replacing the existing representative democracy, acting on behalf of the majority. Which, I mean, I don't know about y'all, but sounds very much like Congress to me, very much sounds like what our system looks like to me. And so this is just a direct quotation from someone who is one of the founders of this type of thought of what this system means. Neoliberalism is often associated with Margaret Thatcher, Ronald Reagan, Pinochet. Does anyone know who that third guy is? Yeah. Do you want to shout it out? Or does anyone want to shout it out? I just keep it in here because it's really important to remember that when Chile had a democratically elected socialist president, the United States conducted a coup to have a military dictatorship, which is Pinochet. And that guy is the one who established a bunch of neoliberal reforms in Chile. So, now that we said the terms neoliberalism and Ronald Reagan, I cannot take credit for this. This is from Twitter. If you look up my favorite activity is to add Reagan Twitter, then you will find this tweet. Now, let's just look at this. So, when Ronald Reagan basically re-upped neoliberalism and trickle-down economics in the United States, what happened? Well, while we were originally on par, I'm going to just use my mouse. While we were originally on par with all the other OECD countries, suddenly we are spending way more without seeing any level of life expectancy improvement, and we are totally leaving the pack. Not even in the bottom of the pack, just completely away, diverted. Here we have the top 1% versus the bottom 50% in terms of share of all national income in the United States. As you can see here, Ronald Reagan becomes president, the bottom 50% of the United States completely drop off in terms of the share of wealth they own in the United States, versus the top 1% just completely eclipsing that. And here, for comparison, is the Western Europe. Here is the bottom 50%, and here is the top 1%. And sure, there's an increase, and it looks nothing like this graph. Here is a percent increase in the annual cost to attend the University of Illinois, a public university. This is the raise in tuition. In contrast, the median income and minimum wage increases, with a huge gap. Here we have income gains shared or income gains shared. So basically, the idea of the change in your income, the amount that you gain over time. So originally, even if the top 1% are wealthier than the bottom 50%, on par, those groups are gaining income. They're gaining wealth until Reagan. And then now we have the top 5% here, and the medium and the bottom 20% increasing less over time. So the wealthy are getting wealthier, and the poor are getting poorer. And finally, another Economic Policy Institute gap of the gap between productivity and a typical worker's compensation post in the 1980s. And so what we see here is that whenever someone tells you that this generation or that everybody who is working right now is ungrateful and not working hard, you can remember that you are way more productive, and maybe not you individually, I don't know you individually, but our economy in general is way more productive without seeing the benefits of that productivity. So why do I bring that up? That is kind of the context for where we are at right now. What are the social changes, the laws, the kind of data that shows the context for where we were when COVID happened? This is a demonstration of what did the U.S. do in response to COVID. So this is under Trump, the CARES Act. I obviously did not go way in depth of all the things that the CARES Act did, but one example of what it did was the Paycheck Protection Program. And so basically these were small loans that were given, or loans given to small businesses, quote unquote small businesses, to be able to keep their workers afloat. It was basically a trickle down of the government to a company to the employers. What they found was that nearly 75% of the funds that were distributed through the PPP ended up in the top quintile of wealthy households. As you can see here from the CARES Act, the total $2 trillion coronavirus stimulus bill, large corporations received $500 billion. And a Journal of Economic Perspectives kind of quotation to demonstrate what the point of this is the idea that this is kind of own, but harnessing modern administrative systems, other high-income countries are more able, more capable, better at distributing funds in a way that is equitable, and the United States just doesn't have the capacity to do that, is what this quotation basically says. Now, the reality is that I am not here to tell you that the American Rescue Plan that is under the Biden administration, that is quoted as one of the most progressive things that a president has ever done in the United States. I'm not here to tell you that that was worse than the CARES Act. Of course it wasn't. Of course it wasn't. The intention was to have more wealth, more services, just more driven towards lower income and middle income people in comparison to the CARES Act, which Trump enacted, that almost certainly benefited wealthier people in general. So there's a bunch that the American Rescue Plan did. They had an extension of unemployment benefits, housing assistance, and eviction moratoriums. Healthcare providers received more funding. Community health workers received more funding. That is essential under the Biden administration. We have certainly seen an importance that is long overdue given to community health workers. There are various transportation provisions, but I want to go over basically two things that the American Rescue Plan did and identify how that is a neoliberal reform. So what are the challenges that we are going to face having like that be our solution versus more transformational reforms? So a success point that is quoted often of the American Rescue Plan includes the expansion of the child tax credit. This, I'm not going to go in depth to it, but what you can basically gain from this is the idea that this tax credit back to families reduced childhood poverty by almost a third. Almost a third. We certainly in the United States have way more child poverty than any other Western or developed nation, and we were able to reduce that a third with this child tax credit. And so what happened? Congress did not vote to extend the childhood tax credit. However, I will say that it was a letter by like 200 or something economists to promote the idea of the child tax credit. Biden in his 2024 budget proposal included extending the expansion. He spoke like about how that would be a good move, basically. And so my takeaway from that is that bullying works. You need to bully our representatives. They work for us. Like I mentioned in the Friedrich Hayek quotation, we live under a system where an elite mass get to distribute our resources. And so we, en masse, can bully and pester and prod and show up and show up and show up and show up. And eventually, someone in good faith will have to respond. So that's one thing that I wanted to point out, is the idea that when something happens and it works, it can go away. It can go away because we have a Congress that has to continue to fight whatever interests, or just basically there's a lot of complications there, but whatever we win, we don't get to keep. We're asking for breadcrumbs and then we try and hold them because someone's trying to take them away from us. Now, again, I'm not trying to say that this was less progressive. I'm not trying to say this was less progressive. I'm trying to say this is more progressive than the Trump Act, the CARES Act. And in fact, an important economic institution found that the Biden American Rescue Plan boosted the income of the poorest 1/5 of the Americans by nearly almost $4,000. Wow. After decades of stealing wealth, extracting wealth from people, we are now giving people $4,000. So this is the most progressive plan that has ever happened in the United States. And I'm being a little bit silly, but this is what I'm trying to convey, is that we are celebrating and we need more. It is ridiculous that this is the state that we are in and this is considered a win. The other thing I want to add is that what the US did in response to COVID was basically give money to people to buy insurance. So that's like what a subsidy is, right? Now, this is very similar to what the ACA did. So what the ACA did was basically 57% of uninsured people were eligible for financial assistance to be able to afford healthcare. So what you can see here in this graph, this like dark blue, it is on here. Okay. So this dark blue is the ACA. And so it's like for all people, for below 150% of the federal poverty line, 150 to 250, so on. This is how much of a subsidy in terms of like an individual premium cost you are receiving from the government to be able to pay that premium. And this light blue on top is what the American Rescue Plan Act added. So we went from, in terms of our entire 44 million people who are uninsured in the United States, 57% after the the Affordable Care Act were eligible to be able to get assistance. That's not getting insurance. That's eligible for getting assistance. And then now, under the American Rescue Plan, 63% are eligible. Groups left uncovered includes undocumented immigrants. That's around 4 million people. And in our first lecture, we covered the idea of the chilling effect and the idea that people who are eligible to get subsidies, to get SNAP, WIC, all the other social services benefits, when you are in a family with mixed documentation status, you are almost a fifth less likely to go access those services. So there is a ripple effect with this. The second group that was left, the most populous group that was left uncovered, includes people who are technically offered employer insurance just enough, and maybe they can't afford it, but they're technically offered it, so they're not eligible to get these subsidies. And then the third is the Medicaid coverage gap, and that was covered in the second lecture. So, like I mentioned, what did the ACA and the ARPA do? They gave you a voucher to buy a good off the private market. What it did not do is give you health insurance. It just gave you a ticket. So, from our first lecture, if you remember this graph, by default, you are here. You are in the gray. Unless you are represented by private health insurance, Medicaid, Medicare. Some of what the ACA did was when it raised the age to 26, it increased this part of the pie, right? For like you to be able to stay on your parents' health insurance plan until 26, or most likely private health insurance. The Medicaid expansion component was supposed to expand this. But one thing to remember here is that who represents a lot of these uninsured people in the United States? States that did not expand Medicaid. So when we think about people who are left out in this equation with the ACA and the ARPA, subsidies, people in Texas, people in the South, people who have not expanded, states that have not expanded Medicaid, the vulnerable and the marginalized in those states don't benefit from initiatives like this. In the meanwhile, the point of this slide is that companies are making money off illness. That's their motive, and that is uniquely American. So, under the ACA, health insurers, the stocks rise. I mean, like the stocks really skyrocketed after the ACA. And how could that be? It's because the ACA solidified the private market, and we'll go more into this in the next lecture, universal healthcare, what it can and can't solve. But what it did was really solidify that system. And so insurers knew that they got more customers. So again, what the government did was it gave you a little ticket, and now you are guaranteed, hopefully, customers to an insurance company. So that is kind of how you can understand that they became more profitable. Also, U.S. health insurance insurers doubled their profits in the second quarter amid the pandemic. Now, some of these profits have since, or like the fact that there was a rise in profits is not consistent. And what does that mean? What that means is that private health insurers are going to continue and maybe do even more to withhold care because they are trying to see their numbers go up. Number needs to go up. If number went up during the pandemic, but then the next year number didn't go as up, then they are going to do what they can through Medicare Advantage, through all the other things that we talked about in the second lecture, to be able to withhold care from you. This is another slide just kind of reminding us that the ACA helped, not hurt, the healthcare industry. And in contrast this, we went over this in the first lecture, but the idea that currently, as our system stands, we have a flat or regressive tax. So the CEO of a small company or even a big company and an employee are going to pay around the same rate for the group insurance that their company gets. In contrast to this, single payer is predicted to increase the income for the bottom 95% of the population. And even if you're in these top 5% of earners, it honestly does not hurt you as much as the richest 400 households in the entire United States. I want to make sure that I get this statistic right. Post-COVID, the top 10% of the wealthy in the whole globe, now own 76% of global wealth. And now currently in 2023, the top 1% in the United States make 132 times more than the bottom 99%. And so that is kind of a piece of evidence to remember that when we talk about transformational reform will save this much money for the bottom half of the population in comparison to the American Rescue Act that got poor families $4,000. This is just another reminder that there are 30 plus studies, including the Congressional Budget Office, that find that we would reduce spending, we would increase worker earnings, we would increase longevity and labor productivity, because that is the only way we measure health, is how you are able to go to work in the United States, have found that single payer would benefit us. Another kind of point to include is that universal health care would have saved about 212,000 lives in 2020 alone. 105.6 billion of medical expenses would have been saved, and these are in addition to the calculated 438 billion expected to be saved by single payer in a non-pandemic year. And I am happy to share these resources. And finally, another transformational reform. This is a Harvard study that found that reparations for Black American descendants of persons of enslaved in the US would not only have provided wealth and less transmission of COVID to the lower half, the lower bottom 55%, or bottom even 95% of the population. Overall, we would have had less infections. Overall, we would have had less deaths, because like I mentioned earlier, a virus does not respect boundaries. A virus just propagates as long as you let it propagate. Now, I want to end here and allow for our two awesome MS1s to quickly say their portions. And at the end, if we have time, we'll try and ponder this question. Oh, yes. Thank you. For those of you who walked in late, can you please sign in? It would really, I'm so sorry. Thank you, I appreciate it. Oh, yes, okay. And so, thank you. And with that, I'm going to hand it off to Carolyn.
Thanks, Yosha. Hi, everyone. I'm Carolyn. I'm an MS1, and I'll be talking a little bit about grad student labor organizing post-COVID. So here's a story, and I got this from the New York Times. So this is just outlining how bad working conditions were for grad students. There was one grad student who was a third-year PhD student in biophysics, and he couldn't even afford rent. And this is not, an uncommon story. This happens to grad students all across the country, and I'm sure you might personally know, like a friend or a relative who's gone through something like this. And so he actually had to sleep in his car and like couch surf in friends' houses for 2 months. He ended up joining this strike across all the schools in the UC system, which I'll go into a little bit later. But he said he's accruing debt. He can't in good conscience tell people, oh, come be a grad student at my school, because I can't even afford my own rent. And especially, living in California, the cost of living there is just not feasible. Oh, go back. All right, so a little bit more on the working conditions for grad students. So there were unlivable wages. So for example, $15 an hour in New York City is just not going to cut it. There was widespread food insecurity. So I don't know if you guys have heard of grad student food pantries, but like my undergrad had one. And it's sad how grad students can't even afford their own groceries. There's a lack of childcare support. A lot of grad students are parents, which a lot of people forget about. Poor healthcare coverage, and then a huge lack of support for international students. So how do you form a union? What does this process look like? So you're a grad student. you want to improve your working conditions for yourself and also your colleagues at your school. So what are some groups that you can join? There are a ton of groups. Some are nationwide, some are like more private groups on your own campus. But for example, there is the American Association of University Professors, and there is a fee that you have to pay to join the group, but it's not like an astronomical fee or anything. So for this one, it's like a set $115 a year. There is the Texas AFT, which is just another union for teachers and professors in Texas. And for this group, they specifically break it up by income bracket. So, for example, if you're making like $30,000 or less, you'll be paying $71 annually to join this group, or like $5.92 monthly. And then if you're making more than $120,000 a year, you can be expecting to pay around like $315 annually, or about $27 monthly. So they try to make it fair by like dividing it by income bracket. And once you join these groups, then you can be supported by people who understand the rules and the regulations. They'll help you organize, either if you want to go on strike or protest, for example, just how that process can go on your campus. And then I just wanted to highlight more of like the private groups that exist like on campus. So there's Underpaid at UT, which I did not go to UT for undergrad, but Nima filled me in on this lovely group. So they actually, rather than going on strike, they hold protests. So last year they held a big protest outside PCL, and they're just advocating for higher wages and like better working conditions for grad students at UT. So this is a national movement, especially post-COVID. There were over 15 strikes last year alone. Pretty much like a majority of the schools, so like MIT, Clark University, like New Mexico State University, they've all voted in favor of unionization. And at most schools, like you're protected and you have the right to unionize and advocate for your rights. And then, as I mentioned before with the story, the largest strike that happened last year in November was throughout the entire UC system. So there was this huge walkout, and there was like 43,000 people involved, and they just said, no more. We need better working conditions, better wages. And then there was a 10-week strike at Columbia last year with 3,000 undergrad and grad students. And actually, my friend was a student there around the time, and like she wasn't, like the TAs were no longer teaching in labs. So there's definitely like a cost involved, right? So if like all the grad students are going to go on strike at your school, who's going to teach the students? And this brings me to my next point, in that, yes, you will have canceled lectures, no office hours, and then like research operations aren't going to be as efficient because people are no longer working, but it's for a greater cause, right? So for some of the benefits that have happened in the UC system, since they went on strike, pay has increased by 29%. They've provided better family leave. They've increased childcare subsidies by 27%. At UPenn, they raised the minimum PhD stipend to $38,000, which, I mean, it's not ideal, but it's better than it previously was. And this will begin like this year. And then at Columbia, for example, they agreed to cover 75% of students' dental insurance, and they created a $300,000 emergency fund for their grad students. All right, and I will pass it off to Nima.
So I'll be talking similarly. I'm just going to stand over here, but I'll be talking similarly to what Carolyn just talked about, but I'll be talking about it in the context of essential workers. So I focused on something that I think people are generally somewhat, at least a little familiar with, which is the company. Which is the company Amazon. And so if you look at this picture right here, this is a picture of Chris Smalls, who I'm going to talk about today. And he is like the big union organizer, the kind of like front head of labor organizing at Amazon. So this picture is specifically from April 1st, 2022, which is almost a year from today, actually. I didn't even think about that. But he is essentially celebrating the win, like the vote that was to create the union at Amazon. So that was celebrated and that was passed a year ago as of tomorrow. And so basically some background on this is Chris Smalls. He was wrongfully fired from Amazon in March of 2020 when he led a protest. And he essentially was leading this protest because he was saying, there's no COVID safety protocols. We don't have any PPE. We don't have any protection. We're not able to socially distance and like provide ourselves the necessary like health precautions necessary to come in every day to work. And so he was wrongfully terminated on that front, on that same day, actually, for what the company called violating company's social distance policy during a required paid quarantine when he didn't even know that he had tested positive for COVID yet. So essentially, he got fired that same day. And this is what he quotes in a lot of different papers about this being like the galvanizing moment for him personally. He specifically worked at the Staten Island warehouse. So that's JFK 8. And that has about 8,300 workers there. And so this specific moment in his life, in his like career at Amazon, is what inspired him to be like, you know what, like we are going to create a union and like I'm going to do everything possible to make sure that that happens. And so he becomes, as you see on April 1st, 2022, the president of the first labor union at Amazon, also known as ALU. Next slide. So this is essentially straight from the Amazon labor union website, actually, of explaining to different people who might be a part of the union or who might just work at the Staten Island warehouse, what exactly like workers' compensation is, so people understand like what are the actual demands, what are the motivations that are instigating people to really want to be a part of this union, like what are the benefits for the people who might not know what's in it for them, right? And that makes sense because there was a lot of potential costs that I'll talk about to maybe becoming part of a union. So the biggest things are what I talked about before was just the lack of COVID safety protocols is what really, like I said, differentiated this moment as being a unique place and time where Chris Smalls was like, you know what, enough is enough. So there was some sort of like, I guess like fire started in him because of the fact that COVID just exacerbated the already horrible working conditions that were in place at Amazon. So you see like horrible hours, you see, lack of compensated pay. Obviously, you see everything with COVID-19. You see no workers' compensation, basically. You also see like a lot of speeding up productivity during COVID-19, right? Because there were a lot of people who were at home. A lot of people were ordering stuff online. So just the bypassing of safety protocols as well was also a huge part of what then again, double fold exacerbated poor working conditions for people. And that's what incited people to make the demands that they did in order to organize this labor union. Slide. Okay, so how do they actually do this? Really recommend reading the New Yorker article on this, how to unionize at Amazon. It does a really, really great job of going into detail from this. And I'm not going to spend like as much time as I wish I could on this slide, but essentially what they had to do first and what you generally have to do whenever you are creating a union is getting 30% of the people that the union would represent to sign cards saying that they agree to union representation. And so that's what's written up here is like collecting signatures. And so you might be thinking, oh, 30%, like that's really not that much. But you have to think about like the context in which we're talking about. There's so much turnover at the warehouse, right? There's so many people who like work one day and then leave. There's part-time workers, there's temp workers. It is physically impossible to be able to get like even like 40 or 50%, which is what the original goals of the like founders of this labor union were. So even reaching that 30% benchmark was so incredibly difficult of the 8,300 people that were at the Staten Island warehouse. And so that's the first thing that you do. And then the second thing is being able to ask the National Labor Relations Board to schedule an election. So essentially what that is asking everyone in that warehouse would be eligible to vote. Yes, I do want a union to represent all 8,300 of us, or no, I don't. And so once they were able to schedule that election with the board, then they did what, you could argue is like some of the most important work, which is like galvanizing and basically campaigning, right? Like we've all seen campaigns for like the political elections that go on in our day-to-day lives. You can imagine the campaigning being really similar. Now, it's also important to remember that like Amazon's not like relaxing while all this is happening. There's millions of dollars going into anti-union like propaganda essentially, and having speakers and PR people come in and talk to workers about why they shouldn't join the union, why it's not in their best interest. And so the people who are already working like 10 to 12 hour days are also doing this. And so it's important to remember that like this is a lot of grassroots and advocacy work that's being done on part of the people who are also being like disproportionately affected by these policies. So that's one thing I wanted to point out. But essentially, like I said, April 1st, 2022, the union was formed, the vote was passed for the union representation to occur. And so what kind of happens from there? Now you want to actually fulfill the promises and meet the demands that you built the entire like idea of this union on. So being able to like essentially participate in collective bargaining with Amazon and have some sort of contract between the company and the union in order to make that happen. Next slide, actually. So that's going to be super difficult because it's not like Amazon is super ecstatic about the fact that this union has been formed. And so they are participating in delay tactics. They're participating in appeal processes, stating that like the National Labor Relations Board disproportionately favored the outcome of unionization based off of like political preferences of the current White House and that sort of thing. So it's important to remember that like, they have legally created this union, the National Labor Relations Board, against all anti-unionization like legal appeals that Amazon made. Those were actually all denied by the board pretty recently in January and February of 2023. And so there is overall this win in unionization for the Staten Island warehouse. But like I said, there's already plans to appeal and plans to stall this process in order for them to not engage in these like collective bargaining demands that the union would like to engage in. There's one more slide. Okay, so similar to what Carolyn was talking about before, there are obvious benefits and huge drawbacks as well for a lot of the people who may participate and become a part of the union. One huge benefit is that Chris Smalls has personally been contacted by about 100 other warehouses, Amazon warehouses in the country, about how they can start their own unions. So number one thing is being able to see this, people being able to see this campaign and being able to visualize it as something that could happen in their day-to-day life, whether that's in Texas, Alabama, Missouri, California, wherever. Being able to actually visualize this as being like a part of something that could happen to Amazon warehouses nationally is very, very unprecedented, which is why in the modern times, which is why this was such a big deal. Currently, like the second biggest movement is happening at a warehouse in Albany, New York, where they're trying to essentially galvanize the kind of support that the Staten Island warehouse was able to galvanize. And so that's like one of the biggest wins out of this, because we're just not far enough in the process to where all the demands and the collective bargaining have really started. The one demand that they have been able to get has been around COVID-19 safety policies, but it's also, like Yosha mentioned, it's breadcrumbs, right? It's meeting the demand of making a permanent pandemic era policy by allowing workers to keep their cell phones with them while they work. That is something that I think, I mean, not to brush everyone here in the audience or whoever's listening with one stroke, I think that might be something that a lot of us, or I can at least say for myself, I take that for granted on a day-to-day basis. The fact that I can keep my phone in my pocket and I can check it, whether that's to check a text from my dad or to check Twitter, for stuff that's like maybe not the most important thing in the world, versus like maybe someone's kid got sick and they're not able to know for the next 12 hours because they're going to get fired if they access their phone, so just, I know it doesn't seem like a really big win to us. And I think it's because, or at least to me, initially because I took a lot of this stuff for granted. And that just tells you how horrible these working conditions are for the people in Amazon warehouses today. And this is one example of a company. The costs are very high. So for a lot of these people, intimidation tactics are huge. If you are let's just say you are the sole income earner, it feels very, very risky to join this union that may or may not meet these so-called demands that they're trying to, because you can't afford to do anything to put your job in jeopardy, right? And legally, right, you say, oh, well, they can't fire me just for joining a union. Legally, sure, they can't, but they can intimidate you to do other things. They can make it very, very scary. And we can all imagine like the mental, emotional, and psychological distress that would cause someone, especially if they have so much writing on it. So that's one thing I wanted to say. Also, just in broad strokes, the financial burden of just like the legal appeal process that's going on. Amazon, the company, is throwing millions of dollars into making sure that the initial decision of unionization is actually, they're still trying to get that appealed. And so what you're looking at is this company who has millions of dollars to pour into legal fees, that where is this union going to get that money? Highly reliant on pro bono lawyers, highly reliant on GoFundMe, go figure. And it's just, that is also just like a widespread union issue that you find in unions generally, but specifically when we're looking at like corporate America. And so this is just like labor organizing within one example of corporate America. Another great example, if you're interested, is looking at Starbucks and looking to see what that kind of looks like. There was, I believe it was the Starbucks on 23rd, if I'm not mistaken, for the UT undergrads that did actually unionize, I believe, anywhere from like 1 to 2 years ago. I really don't remember. My timeline is not super great. But that's something important to look into, especially if you're an undergrad at UT, because that makes a difference. There's one last slide I wanted to point out. So this is a quote from Chris Smalls that I thought was really important. Like I said, they haven't been able to participate in a lot of the collective bargaining tactics or like conversations yet with Amazon as a whole company. But this is something that he has said over and over and over again. So I just kind of wanted to take a moment for everyone to like listen to me read it out loud. And it says, for us, whatever campaign is ready to go, the Amazon labor union is going to throw their support behind it, no matter what. We know that it's going to take collective action for Amazon to come to the table. So for us, it's never unsuccessful. These are the growing pains, and we're going to fight and continue to grow. And this is just to emphasize that, like, for a lot of these people, like, the costs are high, and that is true, but the benefits they are so determined to the benefits and to the demands of the other people that are working around them, that they are willing to do everything in their power to make this happen. And I just wanted to highlight that, because I think that the fact that people have like the willpower to do this on a day-to-day basis is pretty incredible. So I just wanted to emphasize that. So that's it for me.
Okay, so I just want to say another big thank you to our MS1 superstars, Carolyn and Nima. That was an awesome presentation. And kind of some of the takeaways from this lecture that I hope y'all are able to sit in includes: one, the structural determinants of health that trickle into the social determinants of health that ultimately mediated COVID-19 outcomes in the United States. We have the highest death toll, and it was incredibly inequitable. The other kind of portion of this lecture that I hope you take away is the idea of what is transformational reform. What are the ways in which we could reform our system to truly benefit the people who work and support it, versus what are the breadcrumbs that we have been receiving over the last, however many years. And the last thing is the idea of what is power. We started talking about that in the first lecture, and I'm redefining it now, and we'll talk about it again in the fourth and fifth lecture. But what Nima and Carolyn demonstrated through their presentations is the idea that, yes, power is in organized capital, like we talked about last time. The idea that Amazon can immediately spend $1 million to do whatever they're doing for anti-union tactics. Versus there's also power in horizontal power. You can leverage community. You can leverage relationships. You can leverage the fact that you are the laborer. You are the one that is producing the wealth at that company. And you can leverage that in order to get the gains and the respect and the dignity and the safety and the money that you deserve. So I hope you guys enjoyed it. And if you didn't, totally fine, but please use this feedback form to tell me. And yeah, if you have any questions, you can come up. One thing that is on the feedback form that is not required to fill out, but I would love it if you did, is the idea of pondering whether or not COVID-19 was a rallying moment for sustainable change. Some of the examples we've given include the neoliberal reforms, like the American Rescue Plan Act, ARPA, and then also the labor organizing that Nima and Carolyn mentioned. And so there's, whatever your kind of background is, in addition to this lecture, if you want to give like a sentence, that'd be awesome. Yeah. And thank you to our Zoom audience. Y'all can go.